Welcome all you Earth animals to our latest Ask Our Vet Live, remotely from what I'm calling the Ash Creek Fish Tank Studios, also known as my lobby of my practice, right? So welcome everybody. I'm very excited for today's show. For those new viewers who may not know me, my name is Chris Hansen, Dr. Chris, everybody calls me. I am a small animal practitioner that's practiced medicine and surgery for the past 25 years. For the past 21, I have owned my own practice. And I also, one of my favorite things that I do these days is I work with Earth Animal. And I work at Earth Animal doing product development with the development group with Dr. Bob and several other people, but for both the retail and the veterinary space. And right now I'm working on a veterinary line currently, Dr. Bob and I are. So very excited about that. More to come on that for sure down the road. Anyway, I'm really excited for today's show. We, as many of you know, November is National Pet Cancer Awareness Month. This is something very near and dear to a lot of our hearts. And we wanted to dedicate a show to it today, okay? My guest today, again, need no introduction in this space for sure, but they have tirelessly worked for decades to improve, preserve, and enhance the lives, the quality of all animals and the earth. And they passionately believe in another way of doing things, and healing, protecting, nourishing, and treating our pets, right? So I would like to give a very warm welcome, very warm Ask Our Vet welcome to Susan and Dr. Bob Goldstein. Welcome, guys.
Okay, Chris.
Thank you, Chris, for your kind words.
Thank you.
Anyway, one of the things when we were talking, we obviously saw this month coming on, and we wanted to dedicate a whole show to it, because I know that this is something that is really near, cancer and treating animals and prevention of cancer in animals is something that's really obviously very near and dear to your heart. When I was preparing for the show and, obviously practicing and doing this day to day, I know what we're facing as far as cancer and as pet parents with all of our furry animal members. I know what we're facing. I see that it's on the rise. I see it in animals that are younger than ever before. And I, see it on a day-to-day basis. And so I thought what we do is, I thought I'd talk about a couple statistics first before we begin the discussion, just to kind of, drive the point home that this is a very serious thing. There is a lot of this in our animals. And so just a few statistics that I put together. So depending on where the source you get it from, there are about, and it's really almost 50-50, but as far as population of companion animals in the United States, cats and dogs, there's around 80 million of each of them, which is amazing how many, right? I mean, that's and how it's grown over the years. But of those, there's approximately 6 million cancer diagnoses made in dogs and 6 million in cat on an annual basis. I mean, you think about that. That's a staggering percentage, One in 4 dogs will be diagnosed with cancer in their lifetime. And it's become the leading cause of death in dogs over middle age, which again, and this was one of the statistics that really, really blew me away. And even I was taken a little back by this. 50% of dogs and almost a third of cats over 10 years of age will pass away with cancer, which is far too many. And it's something that, we really have to, we have to put our heads together as a community. We have to, and I know, again, you guys have been working and doing this for years. And so what I wanted to do is, I know, again, when you founded Earth Animal over 40 years ago, right? And I know, again, it was near and dear to your heart then. And I just thought you could tell the viewers your story, on how you began this, how we started looking to another way, and what was the impetus behind that.
Well, the cancer part of it really was personal. My sister and I, aside from losing our first dog, a boxer, to cancer, my sister and I are experienced 3 generations. We've lost every human in our family. So, there was a connection there. And I felt strongly that Bob and I should just look into it to see if there were more compassionate ways of dealing with it. And we did together, we did study a great deal with alternative cancer therapy leaders, healers, MDs, scientists, researchers. We even left the country off and on for 5 years. This Lee was the springboard because we learned that through diet and supplements and through an organic way of life that you could cure arthritis. So he was the jumping board for us. And after we worked successfully with many arthritic patients, then Dr. Bob had the courage to say, well, if it works for this degenerative condition, maybe with crossed fingers, we can get good results with cancer. That's how it started.
Yeah. I mean, it's, so literally you've been then just progressing and doing this over the past 40 years and a lot of this initially, I'd imagine, is a bit trial and error. You're looking at certain things, you're saying, well, this extrapolating things, right, Bob? I mean, when you started, a lot of these things weren't really accepted throughout the veterinary community. I mean, it's one of the beautiful things now that as we see, it's for a person like me that loves the integrative approach, right, in my practice, and you and I have been doing that for many years together, and it's what I always credit the two of you for opening my eyes as a traditionally trained veterinarian, those 15, 16 years ago, where you come in and say, look, we can really better the lives of sick patients and prevent disease and push out disease and things like that by integrating these things into your program. And I shout it from the rooftops. I mean, the two of you really opened my eyes to that. And when you and I started working on integrative approaches to disease early on in my career, it really was, like I say, an eye opener for me. But I do love the fact that now I see it becoming more and more mainstream.
Yeah. It is very rewarding to see what is happening. When we started back in the mid-70s, obviously there was not many holistic veterinarians around, and there was no internet to really gather all the information that is really needed. So now these days it's been, having all that kind of knowledge available for you, and the fact that we now have integrative oncologists available who would look at an animal with cancer and not just focus on chemotherapy, but focus on the entire body, is very rewarding from our perspective. So, 50 years later, we're in a different ball game. I think one of the things that you said that really is a red flag is that the incidence of cancer 50 years later is still about the same. When I started practice, it was a disease of older animals. And now what we're seeing is a disease of much younger animals. So getting an animal 2, 3, or 4 years of age with cancer is not unusual these days. So that's the sad part about it. The good news is there's a lot of integrative therapies that can really help these animals go through their therapy and live a much longer and really much more peaceful life.
Well, yeah, and it's also, as a practitioner, it also changes the way, besides the integrative approach, it also changes the way diagnostically you have to look at sick animals, because where, in the past when I first started, if you had a sick 2-year-old animal that came in, neoplasia, cancer was at the end of the list, but unfortunately that's had to move up in your diagnostic protocol, what you're looking at, because in your rule out list, because we do unfortunately see this happening in my opinion, much younger animals. And, one of the things that's hard to get statistic wise about national trends in cancer, because, cancer is not a reportable disease, right? My opinion is there's probably more than even statistically we're seeing, because it's very hard to gather a national database on cancers, because they're just not being reported by, the local veterinarians, because it's not, there's no national database. So it's not reported. So I just go based on what I see. And, like to your point, Susan, I've had many family members with cancer as well. And, I can't tell you, I've been down to New York and places like Sloan Kettering way more than I would ever want to. But I have also noticed over the years in going into that hospital in the human realm that each decade that I've been there, it looks like the people are younger and younger and younger. And I approached one of the nurses last time I was there, and I said that very fact. I said, is it my imagination, or are the average age of the people that are on these floors younger? And she said, without a doubt, they are. But at least it's scary, and it is. It's scary, and and it's the same in animals. And I think that the bright side to this is, again, that people and mainstream and traditional veterinarians are listening. They're becoming much more integrative, and I think it's because of efforts from people like you guys that have been, again, not to use the term again, but shouting this from the rooftops, right? And saying this for years and years and years. And I know sometimes it takes a little, goes a little slower than you like, right? But it's also, I find, driven by, it's one thing to talk to veterinarians and talk to doctors and say, look, there's a different approach we can take here. We can take a holistic approach. We can take a integrative approach. And it's one thing to say that to them and talk to them, but it's a whole nother ballgame when their clientele are coming in and they're hungry for the knowledge of this, right? We have a much bigger group. We have younger people that are growing up with this, that are asking specific questions, that are knowledgeable and in the know, that are really driving these changes. And that is a wonderful thing. Yeah. That's a wonderful thing.
We don't totally agree.
It brings to mind, obviously it used to be a disease of the elderly, with the exception of younger animals were succumbing to cancer. And Bob and I did spend a great deal of time focusing on that issue. And that has to do with insecticides and pesticides on the body and internally being taken. So that was our launch into nature's protection, which is an organic approach, a safe approach to flea and tick treatment and prevention. But the truth is that it's no longer a genetic disease, and it used to be genetics and an age-old disease, and that's gone. Cancer doesn't care. It doesn't care if you're a boxer or if you're just a mutt. It doesn't care.
Right.
And that's kind of scary. We can genetic engineering, of course, is the way to go with cancer. And with humans, it's really difficult to tell people, please don't procreate. Go out and adopt a child instead if you've got it, your genetic makeup. But we can do that with breeders. And over the years, I've noticed that there are more and more breeders who are conscious, who have stopped breeding cancer. And that's something that's a very powerful network for pet parents. Mm-hmm. If you are going to purchase a dog, if you're going down that route, then you need to do your research and your homework and applaud the breeder who can prove to you that he or she has stopped breeding cancer.
Yeah.
It really is. I mean, I see certain cancers I used to see very rarely that I see more prevalent. And again, to your point, there used to be certain breeds of dogs that just, like you mentioned, boxers. Boxers had a high incidence. Golden retrievers, things like that, had high incidence of certain cancers. But that while there is some truth to that remains in genetic lines, that is the bulk. I see these cancers in all breeds, all sizes, mixes, rescues, everything, you know, and certainly less in genetically biodiverse animals, without a doubt. Okay. But certainly we're still seeing it. So there are these other factors that we have to take in account. You know, it was a rarity when I was first practicing that I would see a mast cell tumor. You know, you'd see one and you'd have it on the end, you'd take it off. And they used to, you know, we always got these grading, they grade them 1 to 3, you know, 1 is, you know, it should be curative, taking it off, you know, and first of all, I'm seeing so many more on so many different animals, and animals coming in young with multiples or having their first one at a year old. But then I don't think I've had a grade 1 in years and years. You know, they're just more aggressive. They're more, so, you know, whenever it changes the way you have to practice with when you're palpating lumps on animals, and you have to be more, you know, you have to think about removal more often on things, because, you know, there are a lot more of these things are coming back neoplastic, you know,
Yep.
and it
Absolutely.
really,
Yeah.
So I think that's probably a good, you know, as we're talking about it, I think, you know, one of the things that we want to talk about, you mentioned it a little bit, is triggers, right? What we can do to lower the incidence of that. You know, Bob, you know, we'll go through some. I think one of the things we talk about, I think diet's a big one to talk about, right? And, you know, it's, you know, having you and I, we're doing a lot of work in discussing microbiome and how much of the immune system is in the guts of us and our animals. You know, 75% of your immune system lies in your, you know, intestines, in your guts. And so it makes sense, and it follows that a healthier gut means a healthier animal and an ability to stay off and fight off invaders of all types, right?
Absolutely. Yeah, and the microbiome, you know, the good news now, unlike 45 years ago, is that there are technologies now that are really going to help in the fight against cancer, microbiome being one of them. You know, being able to assess the microbiome, the health of the microbiome, which is 70% of the immune system, and understand what the problem is, and more importantly, how to fix it, is really going to go a long way in helping to prevent cancer from showing up to begin with. And certainly anybody who's dealing with cancer, supporting the intestines and the microbiome while the animal is going through the therapy for that is really important to improve the day-to-day quality of life of that animal.
Right. And, you know, the other thing that you mentioned, so, I mean, diet, obviously very important. And we all know too, and, you know, I can speak for myself, you feel better when you eat better. You know, you may, you know, I'd say, and certainly if you know, everyone could slip once in a while and you eat something, you're like, oh, that's going to be delicious. And you know, it's not good for you. And you know that you feel awful after you do it, right? It's something that your body tells you this is not what you should be eating, you know, and it affects your biome, it affects your immune system, it affects their overall health. And really what we're starting to find out is mental as well, anxieties, things like that, because we know the healthier we are, the better we eat, the cleaner we think, the cleaner our mind is, the better things like anxieties, the better we have to deal with adversity as it comes. And I think that really you know, there being more and more studies are being done. The one out at UC Davis saying that really, you know, some of these anxious dogs can certainly be bettered just mentally by a better diet.
Mm-hmm, absolutely. You know, and you know, if you lump the triggers together, there's a number of them. Obviously, genetics is usually at the top, you know, for these genetically prone dogs. But as you said, you know, genetics is not as important now because you're seeing it in mixed breeds, you're seeing it in all breeds. You know, so genetics is a part of it. Certainly, a healthy diet is really, really important. Vaccinating with wisdom, not over vaccinating, because vaccines have been associated with the onset of cancer. So that's really important. Not using the animal's body as a delivery system for a poison when you're dealing with fleas and tick is another really a trigger. You know, if you're dousing the animal with a poison to kill these fleas and ticks, the poison is going to have an adverse effect, not only on the microbiome and the immune system, it's just going to lower the animal's resistance. So that is another trigger. So, Not over medicating chronically, not over vaccinating chronically, not using flea and tick prevention that is really, really hazardous for the health. What you need to do is look at all those triggers and remove them and let the animal's own innate immune system take over and help on the prevention. More importantly, on the prevention, but even if the animal has cancer, helping with the homeostasis, trying to keep the animal as healthy as possible while the animal is going through the treatment.
Well, I talk about this. I talk about when we talk about vaccines, and I always I always discuss with people, and every animal is an individual, and it's super important that you vaccinate judiciously in animals, without a doubt. There is, if you look back, you remember in the 80s and 90s where the cats were getting fibrosarcomas. You remember that, and because every year the cats would come in, no matter what their situation was, and they would get 3 vaccines in the back of their neck in one place, and all of a sudden they started cropping up with those fibrosarcomas, right? And they obviously they traced it back to ingredients in, damage to the tissues over vaccination. And, I have to tell you, knock on wood, I think, as a whole, and I certainly, from the time I graduated and I was out in the mid 90s, and it was not a popular thing to do, trust me, back then when I came into practice, and I would say, I'm not doing multiple vaccines, and I'm looking at this, let's assess risks and let's do this. And, some of my bosses were going, what are you doing? And I'm like, well, it just makes sense. We're trying to protect their immune system. I mean, to me, even back then, I was thinking that way. But I think it's hugely important. And I have to tell you, I mean, I have not seen one of those fibrosarcomas in quite some time. I have not, which is great. And I think it's because the community, once again, enacting change, the community as a whole, really, really important. It's and I think as time goes, we're getting more and more people on board with that idea that, what is this animal's risk? What do they do? What do they need? Can we do titers? I've been doing more and more vaccine titers, right? Because we can do that. And I think we're drawing blood for an annual health profile. It's just an add-on. We don't have to take any more than we do if we, and we can actually see, are they protected for these things? And if they are, there's no reason to give it to them.
Absolutely.
Bravo, Dr. Chris, bravo.
I'm telling you, it's you guys. I mean, I'm giving credit back where credit is due.
When the titer testing was first available, we were dancing in the streets.
Right.
It was such a breakthrough.
Yeah. So I think that just on the triggers, it's important for the people to understand what is in your control as the guardian of the animal is to reduce those triggers, especially in a genetically prone animal that is prone to cancer. So not relying on chronic use of medication, vaccinating with wisdom, meaning not over vaccinating, not using chronic use of medication, try to use natural methods as much as you can, feeding a diet that is really a healthful diet, that doesn't have all the byproducts, that's not overly cooked, that's not overly processed, not loaded with all sorts of chemicals and dyes and coloring agents. All those are important. So removing them one at a time really helps that animal's own immune system really fight better against the prevention of disease, all disease, GI disease, arthritis, skin disease, and cancer. So those are things that people can do and should do for the health of their animal.
Go ahead, Sue.
Back in the 80s, we started a little campaign that said, your dog really should have a salad every day. And what we were really trying to say in a fun way is that, those were the days where there was nothing but kibble and canned food, nothing. And so, these animals are starved for phytonutrients, for antioxidants, for life force. Think about it. Think about what they had to endure and the boredom factor, but what the body was enduring with this type of diet. So I think it's the realization that we can be more human-like as we feed our animals. We do something at home with our dog Jack. We call it the lettuce jump. An organic romaine he gets every day. We've turned it into a game. We throw it in the air and he ingests it. But what he's ingesting are antioxidants and phytonutrients and healthy roughage. And it's just, that's just a very important part of it all, I think.
Yeah. Well, I think in making it to your point, starting and just like us, where you want to, with your kids, you want to teach healthy habits as children. You want to start them young, and when you say, and any dog, it doesn't have to be your, what we talk about, your at-risk breeds, because, honestly, they're all at risk. We know that, right? And so with your dog, with your dogs and your cats, getting them on a good, healthy regimen with a good food, and, looking at their health protocols and discussing it with your veterinarian and really asking questions to your veterinarian. What are they at risk for when you go into the office? I'm a big fan of, I love an annual blood work and I love to do it younger, and it's not, some people say, oh, well, it's it's not about that. It's about, I like it. First, it gives you a baseline, where their baseline is young. And secondly, it's good. You can pick up trends in an animal at a young age and adjust their protocols. I think it's really important.
Definitely.
It gives so much truth and clarity.
Yeah, the blood will show things long before a disease shows up. The blood will have indications that something's going wrong. And that's really the time to pick it up. And the prevention part of it can start right then and there. So I totally agree with you.
Well, and that's what you were doing. I'm sorry?
It's a very good investment for families.
Yeah.
I totally agree. And I did, what I did at my practice is I looked at things I wanted to have in it and contacted the lab and said, listen, I want these things in a protocol. I would like these things. Can we put it together and discount it for people so that it's financially available to them? Mm-hmm. And they were very open to doing it. And that's what we did. So that's I think it's really important. And that's Bob. That's what you guys did for years in Healing Center for Animals. I don't know to tell the audience. I know a lot of people know about it, but I have my own kind of. I love to talk about it. But the Healing Center, what you did with blood profiles and everything else.
Well, the blood really tells what's happening in the body long before it shows up as a disease later on. So what we were able to do is called the metabolic or nutritional analysis of the blood. And what we did is looked at the underlying physiology. So the blood is made up of a bunch of different chemicals. Those chemicals come from individual organs. So if you can pick up in that blood what is going on in those chemical reactions and correct them at that point, you can get before the disease on the prevention side and oftentimes prevent it from turning into a disease process. So that, in my opinion, the blood is probably the most important thing you can do on the prevention side for animals. Now, obviously, not everybody's going to go to a veterinarian and spring for the money for the blood, but certainly once a year, going to a veterinarian and having blood done so the blood can be looked at integratively, not just pathology-wise, but integratively to look at the blood to see what's underlying it. I think that's really important for prevention.
Well, and you think about it with people, they like you to do blood annually at your doctor and check things. And, 1 year in a pet's life is even longer than that in a human life. So, from year to year, things can change. And I think it is a really good thing. And you're also, I give you credit for this as well. You're also the first person that taught me that when you have a blood profile, just because everything's in the lines of normal does not mean it's optimal all the time. And that was one of the things that I learned from you, because you have to pay attention to trends. Are we running on the low side? Is it running on the upper side? Certain enzymes. So that was also an eye opener for me. Just not saying, hey, this is normal. You look at things because you can see maybe, hey, it's normal, but last year this enzyme was here, and now it's at the, it was at the lower end. Now it's at the upper end, and maybe trending up.
Right, and the body is going to give you signals way in advance. And the blood will show you that, and I think that's really, really important. I wish more veterinarians would do that. Perhaps as you and I get into the veterinary field, we can train more people, more veterinarians on how to do that, because I think it really is important and eliminating some of the triggers that could lead to these serious diseases like cancer.
And because
Right.
the nutritional blood testing can pick up trends, I see an opportunity to develop a detection test, a cancer detection test through the NBT.
Yeah.
Which brings to mind, another trigger, which is vitamin mineral deficiency. And I think that was the beauty of Bob's test, is that we could look at the blood and we could pinpoint what vitamins and minerals were missing, and we could nutrient correct, and you could just help the families get a grip, in one of the areas that is just so important.
Yeah, really, really good.
I think also I wanted to talk about moving to, if now getting to the point, we talk prevention, we talk triggers, things like that. Now let's talk a little bit about a diagnosis, right? We have you learn that your dog or your cat has been diagnosed with cancer. And I think this is where also, Susan, you and I have had a lot of discussions about, and I just thought, I thought maybe you could talk on that a little bit about, in your experience, obviously it's just like if you learned it in yourself, or let's face it, these guys are our family. Okay. They're our family. This is like learning about anybody in your family, any of your relatives. These are, and so there is a big shock. There's a shock when this happens initially. And, so I thought, maybe you want to talk a little bit about that. You really had some good stuff to talk about with me.
Thank you. I would love to. I think that when you get the diagnosis, yes, I do believe that many of us go into shock. And of course, we're very vulnerable at that point. And it is at that point that I strongly recommend that pet parents take a step back and take a deep breath and remember, at this particular time we're sharing, that you have choices. And as you said before, every dog or cat is an individual with individual wellness needs, but also with individual healing needs when it comes to cancer. And in our opinion, there are 3 roads to take. One is, 100% conventional oncology, go do it, but do your homework and know what you're up against and know what your animal's up against. There's another way, it's an integrative approach, where the oncologist and the holistic doctor or the conventional veterinarian, they get together and together they work. And you and Bob have done that quite successfully. And I'll explain what success is later. And then we have the brave ones. We have the 100% holistic. I don't want anything. I don't want chemo. I don't want anything. Just bring it on. Bring me the vitamins. But for me, I think the most important part is to know that you do have choices and to do your homework. And if you do not, oftentimes there can be regrets down the road.
Yeah, and I would just add that one point that I brought up before. When we were practicing and treating cancer in our clinic, there was oncologists and integrative veterinarians, and there was nothing between. So you either went to the oncologist and the oncologist said, you have one choice, chemotherapy, vitamins don't work, do chemotherapy, period. And then the other one was, forget the chemotherapy and the side effects, and you can go integratively. Really what's happened now is that we have integrative oncologist. There's an oncologist who understands chemotherapy, understands immunotherapy, understands radiotherapy, but also has a clean knowledge of integrative therapies, acupuncture, Chinese herbal medicine, homeopathy, nutraceuticals, and they will select what is best for that animal based upon that animal's individual needs. That to me is like a game changer. Didn't exist when I was practicing full time, but now that's available. And I'm giving a lecture on the 12th or 13th of December, and in that lecture we will list a bunch of different oncologists throughout the country who are integrative, who you can tap into and really get the benefit of their knowledge and the integrative approach.
Yeah, and I think the plan was to share the link for that when you do it, so that the listeners from here can tune into that, and there'll be a lot more treatment directive things in that as well.
That'll be much more in depth, much more scientific, and also give them context where they can go if they're looking for the integrative approach. And the 2 or 3 oncologists that I work with, over the years are just incredible. I mean, just really, really incredible. And to have that kind of resource available for the people is just absolutely light years ahead of where I was when I was practicing.
I call that enlightened synergism.
Yeah, it was great.
Yeah, absolutely. That's a great term. I've told you guys a story before, we have a cousin who's a naturopath that was hired out at a major cancer center out in Chicago. This is the human side, and to do integrative work with their team, and when my aunt was diagnosed with stage 4 breast cancer, she was down in New York, and they said, you need to start thinking about making your arrangements. Okay. And we contacted our cousin, and she put together a whole protocol, again, herbs, nutraceuticals, things like that. And, I remember my aunt going in and saying, I'm going to take these. And I remember them saying, okay, well, you could take those, but you don't expect too much, that sort of thing. And, she would go down to New York to an herbalist to get a mushroom tea made up, once a week for the week. And she was drinking it. She was doing all these things. And I remember the epiphany that the doctors down there had when at 5 years, 5 years down the road, they came to her and they said, can we please have a copy of that protocol?
Yeah.
Right.
Really. Yeah.
So it's always good when you have that eye-opening moment in doctors that practice conventionally, because if they're exposed to that, and the more on the human side and the more on the veterinary side they're exposed to those things, the more that they continue to, are proponents of it. And it doesn't take much to watch these guys on an integrative approach or on a fully natural approach, and watch them have a high quality and do well. And that's really what it's about when they are diagnosed. We want them to feel good. We want them to give them the highest quality for absolutely as long as we can. And I think that's hugely important. And I think, Susan, too, when we talk about that, I think the mental and emotional health of them is extremely important, as we always talk about people, their outlook. We can't poo-poo that with them, right?
Mm-hmm. Absolutely.
It's our outlook. They feel everything. Mm-hmm. They know where we are. They know when we're traumatized. They know when we're depressed. Metaphysically, I think cancer, fear is candy to cancer. It just loves fear. And so we need to find a way to get a grip, to become emotionally balanced and strong as we are supporting our animal through the cancer process. And back in the 80s, there was a couple, they were oncologists, Dr. Carl and Stephanie Matthew Symington, as well as Dr. Bernie Siegel, who was at Yale, New Haven. They all deducted that visualization played a major role in remission. And a great deal of clinical testing was done, and Bernie wrote a lot of books about this. So as I counsel pet parents whose animals have cancer, one of the first things I suggest is that we learn how to visualize our animals' wellness. And I actually ask people to just be an artist, create in your mind's eye what your dog or cat looks like well. And once you get that picture in your mind, use it. So every time you've got a fear thought, substitute it for that beautiful picture where your animal is vibrant and well. And it's extremely powerful. I know for a fact that your animal will feel that positivity. Mm-hmm. And it's, that just get it. You have to get a grip on yourself.
Yeah.
You're in it together. We all know that when we've dealt with cancer, whether we've been living with a human or an animal, you are in it together. And it does take unity.
Mm-hmm. Yeah. Well, and absolutely, I can see on a daily basis when I'm practicing in the clinic, they animals feed off their pet parents. They absolutely do. And so, you know, you'll have an animal that's scared in the room and an owner say, I can't understand why they're so scared. And I look at them and I go, you're petrified to me. You're petrified too for them. You know, yes, of course, I see you. The look on your face is identical in the room, right? So it really is that positive outlook makes a big difference in us and them. And I think, you know, I'm even seeing it with the increase in anxieties during this pandemic. You know, I'm having people calling me and saying their whole house anxiety, you know, the parents, the kids, and the animals are all, it happens together. You know, there is a pack. You're a pack. You're all a pack together, right? And it is, I think it's very important.
And of course,
you guys up for, go ahead,
I'm sorry.
No, go ahead.
That brings to mind that we can actually, we can work with flower essences. We can help to balance the emotions. We can help to balance anxiety and fear. I work with emotional balance. That's Earth Animals flower essence. There are other flower essences that are great, but you and your animal can use it to be emotionally balanced and to heal your emotion. You can even treat the house, treat your home, you know, and I do hear a lot about people having more anxiety than normal because of COVID.
Yeah.
Well, it's a change for everybody, you know, and things were changing. So, you know, and all, you know, animals, you know, our companion animals love a routine, right? As we do, but they do. And all of a sudden their whole world was flipped. You know, everyone was all of a sudden everyone's home and then everyone's gone. Then they're back home, you know, and it's a lot for them to process. So I loved when you talked about, to me, Susan, I was talking about flower essences and you said, we were talking one day about what we did on a Sunday. You said, what did you do yesterday? I said, it was so beautiful out. I sat in my yard and it was like, it was in that midsummer where everything was blooming and it was just, now my allergies are a different story, but it was just the pollen, but I was just, you know, it's so relaxing. And I was talking to you about that. And when you're saying about using flower essences and emotional balance in the environment, you said, Chris, we're going, you know, that feeling that you had when you're sitting there and, you know, you can feel the energy from all the foliage and things. So that's what we get. We have that in a bottle, you know, that's what you do. And it really hit home for me. I just had a client come in today that was using flower essences for anxiety in their dog that said they were unbelievable on how well they were working for the dog's anxiety.
Well, animals are energetic, and this is vibrational medicine. So it's kind of like heals like attracts like. And it's just so fitting that we should go to nature and bring them vibrational energy.
It's very cool. It's very cool. 45 minutes already. Can you believe that fast? How time flies? So I think, you know, we'll take, are you guys up for taking a few questions here?
Sure. Yeah.
Love to.
Yeah.
All right, great. So I think, you know, we won't be able to take all of them. There's quite a few, but we'll definitely take some. I think, you know, so Linda has two questions, and I think that we can talk about them together. Her question is, you know, does diet play a huge part in you know, in what we're talking about? And also, are we over medicating with flea, heartworm, things like that?
Yes. Yes. Well, yes, for sure. Yeah, for sure diet. I mean, generally with a animal with cancer, you want to have a good amount of protein, a good amount of fat, and a very low amount of carbohydrates. Cancer cells love to grow and will grow with carbohydrates and sugar. So always try to get certainly a moderate amount or a high amount of protein, a moderate amount of fat. You know, there's a lot of research being done now on a ketogenic diet, which is really very high levels of fat. I'm not sure, you know, if we have proven that, but to lower the amount of carbohydrates and get a good quality food that's naturally put together is really, really important.
May I put my 2 cents in for a minute? When we talk about diet, I think it's also important for people to realize that a lot of pet foods are sourced factory farmed animals. Now, these are animals that have led miserable, unhealthy lives, and they are fed. They ingest hormones and antibiotics. This is not a healthy source of protein. So I think it's really important if in general, but if your animal has cancer, I think it's very important to feed organically. Also, there's the mounting evidence, and I'm hoping that Earth Animal will be able to join the research team in this area, but there's mounting evidence that plant-based diets help cancer. But we're in the early stages at Earth Animal of researching plant-based, but because I was the one that recommended juicing to all of our cancer patients, and because I saw great results when families would juice, I have an intuitive hunch that we're going to see some really good research come out of plant-based for cancer.
Yeah, and in the more in-depth lecture that I'm giving in December, I'm going to spend a fairly large amount of time on the factory farming, the use of chemicals in those animals that concentrates in the meat, and those concentrated meats that have those chemicals in it get into the animal's body and actually raise havoc and reduce the immune function. So I think to answer the question, diet definitively has a definite effect on the body and the immune system.
And yes, we are over medicating, and I do think that we should all, think about what are the side effects of the medicines that we are using if they are being prescribed chronically. There's a time and place for medicine. There's a time and place. God bless surgery; it saves a life. But if it's being recommended that a chronic med is the way to go, then at least check out the side effects.
Right, and look for an alternative, a natural alternative.
Right. It gets back to and it gets back to sometimes you may not go one way or the other, but even again, Susan, like we talk about the integrative, the reducitarian approach. What can we add in naturally? Okay. If we can't completely come off a med, what can we do naturally to reduce the amount that's needed? Right. And I think that's an important thing, because it doesn't always have to be, there's a lot of gray in this. It doesn't have to be black or white all the time. Just like you were talking about with with cancers, there's obviously, conventional, there's integrative and natural. And I think it's up to you to do your research and find out what best suits your individual. And you should look at it all. Yeah.
One thing that was left out this evening, and it's very important. Bob and I strongly believe that if your animal is cancer positive, do not vaccinate.
Yeah.
Do not.
Say it again. I couldn't hear you. I'm sorry.
Don't vaccinate. If your animal is diagnosed with cancer, do not vaccinate.
Yeah. I mean, it comes down to stressing the immune system, right? You want their immune system to be patrolling their body at all times for any abnormal cells to be able to take those away.
Absolutely. Yeah, totally.
Yeah. All right, let's see. And I think, I tell this story too when we talk about the chemicals. When I was younger and in my clinical, rotations, and I was out at cattle farms doing all day, doing ivermectin and doing things that's all, getting all. And when the spot on chemicals were the first things in town back in the early 90s, and when I was using those all the time, I would be out hiking with my family, and we'd come back and my family, people would have ticks on them. I never had a thing on me. And that concerned me because it was obviously absorbing into my skin, because that's what it did. Right. And we handled those things like that all the time.
Wow.
Yeah.
Someone mentioned in here that Barbara said her dog has not been over vaccinated, eats veggies and meat, still got cancer. And she was rescued, and so she's had her only since I think age 9. I think it's important too to say, obviously what we're talking about is reducing the incidence. There will always be cancers, unfortunately, but what we're trying to do is we're trying to bring the numbers down and eliminate as many triggers as we can.
Right, and improve the day-to-day quality of life if they do develop cancer.
Right, exactly. All right, let's see. One person, Bob, was talking about hemangiosarcoma, and it's something that probably one of the top cancers that I see. We see it, and again, I see it in not people talk hemangiosarcomas and they think golden retrievers, but that's not and they think golden retrievers and spleens, right? That is not, yes, that's common, but that is not now the only game in town with that. We see all different animals get it, all different organs. I've seen it subcutaneously. We've obviously, and so, it is something that is very prevalent out there. And I think, obviously genetics does play some role in that, but as we're seeing, it's diversified through other animals. So I think the same thing goes with that cancer,
Absolutely.
eliminating
That's
triggers.
That's probably the worst and probably one of the most difficult ones to treat and to keep under control because it's such an aggressive tumor. Obviously, it's blood-based or blood vessel based, so it can wind up any place in the body. And we're seeing it obviously in younger and younger animals. There is some medicinal mushroom protocols that have proven to be successful. There's research being done on CBD, which is also showing some promise, but it is a tough one.
Yeah. We talk, my poodle who, Monty, who we lost last year, a few years before was, I learned that he had liver cancer, ended up being a carcinoma and that was diffuse through his liver. He was on CBD for 2 years with that. And absolutely, I'm a big proponent. It not only increased his day-to-day quality of life, it helped his appetite. And right up until the end, till he was really having a hard time, he was running around and acting, just having, his best possible life. And I think as they do more studies, I really hope that it continues to play out, that we're going to be able to use CBDs and isolates in a way that can really help some of these cancers.
Yeah, we agree. We agree.
Yeah. All right, let's see if we can get one more here. So Michael asked, when we look as a clinician, what are the early signs of cancer to look out for? And should we be scheduling quarterly blood work starting at a certain age? I think from, I'll answer from my standpoint and, get your feedback. I think, when you talk, the early signs are different for many of the different cancers, right? It depends on what organ they're in. Obviously, soft tissue cancers generally are not painful, right? So there's early detection sometimes can be difficult, right? Obviously, cancers that are in the bone and things are sometimes found a little more quickly because they can cause a lameness or pain. So I think the signs depend, obviously. Usually what can happen in these guys is that if you don't pick up something on a blood work, in the case of, say, a early lymphoma that you see a calcium raised or something in the blood, it's a lot of times it's when they start to impair some of the function of the organ they reside in, right? And that's where we talk about the blood. And so, Michael, I recommend usually when we get into our mature animals, I recommend blood work at 6 months, twice a year. At some point.
I agree. That's when I practiced, that's what I was recommending. Obviously, for heartworms, at the time, this is like the middle 80s, where heartworm was just rampant.
Right.
And the people who didn't want to go on heartworm prevention, what I recommended is to check the blood every 6 months. And if you do get it, then you can treat it early, and there's really no side effects or an early treatment. So if you can test the blood twice a year, I think that's perfect to pick up the beginning of something going on. That's exactly what I'd recommend.
And I think animals are very stoic, and they can deal with a lot more than we can, physically and emotionally. I believe that. So I think, little things like we just lost our dog Phuket. Thank you, Dr. Chris, because you were there for the three of us during her journey. But she was an eater, and she skipped a meal once, and we called you right away. Right away.
Right.
And the rest is history.
Yeah.
Well, but again, to your point, It doesn't have to be a specific sign. It could be something out of the norm. You know,
Yeah, exactly.
whenever somebody calls me with a question about a behavioral issue, my cat started doing this. My dog started doing this. I always recommend an exam and
Mhm.
depending blood work, because, my whole thing is before you start dealing with, behaviorally and talking about how we're going to change this behaviorally, you have to make sure there's nothing wrong physically, because
Absolutely.
oftentimes a behavioral change is coming from a physical issue.
Yeah. Okay.
Yep, that's a golden rule. You're right. Really.
Yeah, that's a good question, Michael.
Mhm.
All right, guys. Well, amazingly, it's I could talk to you guys for 4 hours, and we do a lot, but I think now we're at the end of the show. I think it was great. Thank you everybody for asking the questions. And I think Dr. Bob, what date is that going to be again? I know we're going to put up.
I think it's the 13th of December.
Yeah.
Earth Animal, I think it's the 13th of December, but it's not like until 8:00 at night.
Yeah, but they'll put up, and I urge you guys to go on that. We're going to, and be able to look at that. It's going to be a little more specific. It's loaded with really good information. So it's something that'll be a little more specific as far as this subject goes.
Yeah. Well, certainly more in depth.
Right. Well, thank you guys so much for joining me. It's always a pleasure. Always a pleasure.
Great. Thank you very much. Doing a great job with this.
We
And
appreciate you,
it's
Chris.
really, really good.
Thank you so much. And I just want to say, and you guys will be interested in this too, in 2 weeks, I'm going to be talking with Jesse Baines from Atlantic Sea Farms. So we're going to be talking about aquaculture and the kelp.
Fabulous.
Yeah, it's going to be great.
We'll be listening.
Yeah, it's going to be, and how they're working with the fishermen up there to diversify the fisheries. And so we're going to talk all things sea kelp and nutrition and how it could benefit our pets. So anybody who's on today, please like us, share us, and come and watch us talk some sea kelp. It's going to be really interesting.
Oh, that's
right. All right, everybody. Everybody have a great weekend. Thanks, guys, again. I appreciate it.
Thank you.
Happy
Thank you.
Thanksgiving
Yeah,
to all.
bye.
Oh, bye, everybody.
Bye.